Good afternoon and welcome to Responding to COVID-19 on TTT, Talk City 91.1 FM and TTT Live online on Facebook. I'm Vidia Ramphal. Well, today the Department of Health and Wellness is set to receive 219 St. Lucians who were on cruise ships on the Carnival Glory and Caribbean Princess. These passengers are expected to be received and placed into quarantine for a period of 14 days, as is that country's established protocol. The St. Lucian journalist Terry Finisterre now joins us. Terry, I'm sure there's been a lot of discussion about this in St. Lucia.
Absolutely. Of course, people have been trying to figure out what is happening as far as our overseas nationals is concerned. A number of people, students in the United States, protocols have been put in place for them. And the next big batch of people that we've been concerned about, that citizens have been concerned about, would have been those individuals who have been working on cruise ships and who would have been left stranded by the pandemic. Now we're getting over 200 of those returning home today, or they've returned home today, and they will be placed in quarantine at the medical facility which has been established in Rodney Bay for a period of 14 days in the first instance.
How has the reaction been? Has there been any negativity towards these returning nationals, or are they just happy to see their countrymen home?
I think people are just happy to see that there is movement. Certainly, I mean, for myself, my parents are actually right now stranded in the United States, in New Jersey. I mean, they're in good shape. They're with family, but that's not the case for all overseas nationals at present. A number of them don't have family to stay with, and they're in situations that are not as friendly or as homey as they would like. So it's good to see that there are protocols for our nationals to be able to start coming home. The government has started talking about opening up the country. Today, liquor restrictions were relaxed, and a number of people are very happy about that, as you can imagine. And we've started having some conversation about flights perhaps restarting and some further businesses reopening perhaps in early June.
Yes, but what has been the reaction to by the population towards the way the government has handled the situation overall in St. Lucia?
Well, there's been a high level of confidence, certainly, in the chief medical officer. I think people have been really pleased with the way the chief medical officer and her team have worked to manage expectations, to manage the process of quarantine. We've had, I think we had in the last instance, we had well over 100 people, close to 200 people in quarantine at that same facility, which is a hotel, Starfish Hotel in Rodney Bay. And those are people who were mainly coming from Martinique and Guadeloupe, and Dominica as well, via the ferry. So that was last month, and they were well managed. There were some hiccups in terms of the initial movement and as well in terms of the actual security of the facility, but I think that has been cleaned up. The police have also been commended throughout the course of this lockdown, throughout the course of the quarantine, whether partial or otherwise. They've done tremendously well. And certainly our first responders across the board have been absolutely tremendous. There, of course, has been the usual back and forth as to what could have been done better, what could be managed in different ways. But I think generally speaking, the management of the crisis has been good and has been well received by the general public.
All right, Terry, that's all the time we have. But thank you so much for joining us on the air to give us your update on what's happening in St. Lucia.
John, all the best to you guys in Trinidad. Stay safe.
Thank you very much. And let's turn over to St. Kitts now. And with over 1 million global cases of COVID-19, the region is grappling to minimize the spread of COVID-19 cases. And while some countries are in the clear from the first wave of the virus, some countries are still coping with rising cases. St. Kitts and Nevis are boasting of containing the first wave of COVID-19 to the island. To date, 12 of the 15 positive COVID-19 cases in St. Kitts and Nevis have fully recovered. This according to the Ministry of Health's daily COVID-19 report there. The report states that 12 persons have fully recovered and discharged, and there are 7 pending cases. The Chief Medical Officer of the island, Dr. Hazel Laws, says they have been successful in containing the first wave of the COVID-19 cases. Dr. Laws recognized the tremendous dedication of the men and women that make up the Health Emergency Operations Center on the ground. She said they are continuing active surveillance for COVID-19 disease cases and aggressive tracing of contacts of all cases. Now, let's move across to Jamaica. And as COVID-19 cases continue to rise in Jamaica, St. Catherine has recorded the most with a total of 290. Kingston and St. Andrew are next with 101 cases, and Clarendon is third with 35. 3 communities in St. Mary are now under quarantine as the parish records 16 cases. The most recoveries are from Kingston and St. Andrew with a total of 17. Now, Jamaica has a total of 488 positive cases of COVID-19. Now, the Food and Agriculture Organization is concerned about the impact that the collapse of tourism will have on many Caribbean countries. As it says, the region is a net importer of food. Speaking during the FAO's COVID-19 and Food Systems Series webinar on Thursday, the Chief Economist and Assistant Director General of the FAO's Economic and Social Department, Maximo Torero Collins, says the decline in tourism will continue to affect the region substantially, and that is for months to come.
And the shock will be significantly higher. And now our expectation is that we are talking of a recession that will be more than 12 months, like initially was thought, that the recovery will be very fast, but this is not seems to be the case. Now, in addition to this, some of the Caribbean economies also are economies that are exporters of primary commodities, and this is also being affected because of the decline of commodity prices, and this is affecting Guyana, Suriname, and Trinidad and Tobago, and this is making them to reduce fiscal revenues.
Now, the Minister of Agriculture for St. Vincent and the Grenadines and Chair of CARICOM Agriculture, SABOTO Cesar, says an effective system is needed to move commodities across the CARICOM single market and economy.
I am of the view that we are going to do well in this period. However, there is a need for a recommitment by all member states, all stakeholders in the agricultural sector, persons also in fisheries, and we will be able to carve out a significant portion of the food import bill and create great wealth by moving more commodities intra.
Looking ahead, the Caribbean Private Sector Organization representative Patrick Antoine says CARICOM heads should meet to come up with a regime to discuss the reopening of economies on a regional basis to deal with the financial situation post-COVID-19.
At some stage, we have to get out of lockdown. If we are able to do that, to open up regionally together, now the rest of CARICOM can still be ring-fenced. But if Trinidad is safe and Barbados is safe because we have had no cases over 28 days, we can begin stimulating intra-regional tourism in a bubble in the meantime. That is going to help take up some of this demand.
Well, moving across to Guyana now. Since March 19th, the Guyana journalist John Ramsingh has been stranded in the United States after serving as the media officer for the West Indies over 50 team at the World Cup there in South Africa. Well, John joins us now on the line. John, how have things been going for you in the lockdown in the U.S.? Okay, John, just check your audio for us, please. And of course, John Ramsingh, well known as the Guyana Amazon Warriors media officer, and he was on having his duty in South Africa as the media officer for the West Indies over 50 team. I think the audio is now resolved. John? Whose mic I think might still have to be unmuted. John, can you tell us what it has been like for you when you stepped off the plane in JFK?
I hope you can hear me now, Vidia.
Yes, I'm hearing you now. Yes.
It was quite different. It has been quite different. I've been traveling to the United States back and forth for many years, and this time around, landing at a JFK International, which is perhaps the busiest airport in these parts of the world, on the 19th of March. When I landed there, I was like wondering where I was because it's been quite different, quite transformed. It's what you perhaps will see in a movie. Nothing, no movements. As soon as you exit that airport, the parking lot has been extremely empty. Just a few persons who were there leaving with myself were in the parking lot awaiting their transportation. And that was an experience I've never seen before. And because of that, that set the pace really for what was to come for the next. I'm now here for 51 days. It's been quite different. No traffic, no hustle and bustle. Stores and malls have been closed. People have been just going about their businesses on a daily basis, looking quite different. And by that, I mean wearing face masks and just trying to be discreet in as much possible ways. And it's totally different. I'm saying this because those of you who know what the American system is like, it's been really busy. It's a new world order now because of COVID-19, and it's something, despite we're not accustomed to it, we must get used to it because this developed state, this part of the world, in fact, has been hard hit, and they're taking some serious measures. And it's we're getting used to it, really, Vidya.
Yeah, and for you, John, 51 days in the United States. When you arrived there, were you aware that you may not have been able to get back into Guyana?
When I got to the JFK on that afternoon, it was a Thursday afternoon, I got the hard news that Guyana airport was closed just the day before, without any kind of leeway, allowing citizens who were out to get back in, perhaps a 3 day or maybe a week window period. It was closed immediately. And that was because the first case in Guyana of COVID 19 is what we call an import. And quite strange, ironic, however you want to put it, the person that imported that first case of COVID into Guyana traveled from the United States, more so JFK. So the Guyana government took it upon themselves to just close immediately. And there I was, traveling from South Africa, where I would have been in transit at JFK for just a few hours before boarding my flight home. But I was just 1 day late, and that made a difference. But there was an indication, there was a short closure, it should have been from the 18th of March. The Guyana airport sort of been closed until the end of March. Reopening was scheduled for the 1st of April. As we got closer to the 1st of April, it was extended to the 1st of May, then the 3rd of May, and then now the 3rd of June. But I'll tell you what, Vidya, when I got to the United States on that dreaded Thursday afternoon, I had no idea 51 days later I was going to still be in the United States. This is the longest in transit period.
Yes, yes. There was a movie by Tom Hanks about a similar situation. I'm sure you'll remember. At least you're in a home. In just about 30 seconds or so, John, could you tell us, are your prospects of getting back home? You have been in contact with the Guyana Embassy.
Yeah, just shortly after arrival and settling into my friend's home in Boston, I actually contacted the consulate in Miami because I was not going to go back to New York. New York was actually the hotspot. I wouldn't say of the US only, but the hotspot of the world, where cases were developing rapidly, persons were dropping, perhaps at the same rate. So I was not going to go back to New York. So I contacted the consulate, the Guyana's consulate in Miami, and he actually got me on a standby list. He said, as soon as the airports are open and I can get a flight out,
Yeah.
I'm going to leave on that flight through Miami. So I contacted the consulate almost immediately. That was done. The embassy, the Guyana embassy in Washington, D.C., contacted me shortly after to confirm that I'm still here and that I still need to get home and make sure that everything was okay, was in order with me. I also contacted the government.
John,
John,
we'll have to.
Back home.
I'll have to cut in here, John. We are just about out of time, but thank you so much, and we certainly hope that you can make it home as soon as possible back to Guyana, and all the best to you on your travels there. Well, thank you for staying with us on Responding to COVID-19 on TTC Talk City 91.1 FM and TTT Live online on Facebook. I'm Vidia Ramphal. Please stay home, stay safe, and save a life.